A walkout staged at CDC headquarters in Atlanta today after another controversial move by Health and Human Services Secretary Robert F. Kennedy Jr. He fired all 17 members of a CDC advisory committee that examines who should get certain vaccines and when.
Now, Kennedy insists a clean sweep is necessary to reestablish public confidence in vaccine science. So now several public health groups say they got some serious concerns. Here with us today, ABC News medical correspondent Dr. Darien Sutton. Okay. What are the health concerns associated with this move?
Well, I think taking a step back, so the Advisory Committee on Immunization Practices, arguably one of the most important public health bodies that exists. They were integral in helping us to eradicate smallpox and polio within the United States and developing the childhood vaccine program, which has reduced the risk of up to 16 infections, some of which we are seeing the rise in rate of today.
Yes.
Notably measles, for example.
Yes.
We're 1,168 cases, on track to seeing the highest numbers of measles that we've seen since 1992. Now, in terms of this committee, they are responsible for reviewing the evidence, debating the evidence, creating recommendations, which inevitably lead to coverage for insurance companies so that more can get access. But in dissolving this committee, which is unprecedented, not happened since 1964, unfortunately, it creates more confusion and degrades the most important part, trust, which is so integral to all of this discussion.
Last month, I know Mr. Kennedy announced changes to who would be eligible for COVID shots. What are the potential implications of restricting access to vaccines in general?
I think that the implications are huge, but we don't yet know exactly where they're going to go and what direction. And by that, I mean, we were expecting and hopeful still for a meeting at the end of June to have more clarity. If you'll remember, he removed the recommendation for COVID-19 vaccinations for pregnant women. That was in opposition to the American College of Obstetrics and Gynecologists, who recommend that vaccine. As we know, COVID-19 increases a woman's risk of miscarriage or premature delivery, hospitalization, and death. Questions like that still need to be answered, and the rigorous process in order to get on this committee is incredibly competitive. And so to be able to fill this committee by the end of June, unlikely. How that dictates on the recommendations that come after that, we have yet to understand fully.
So anybody listening to this, you're a parent, you've got kids, you are absolutely confused about which direction you're supposed to go now.
Which is just the opposite of what you want.
What do you suggest they do?
I'm so happy that you asked that. I think to provide a moment of clarity in this cloud of confusion, these directions and these movements were not made from any new evidence. We still understand fully that the vaccines that have been approved and validated and available for children are effective and safe. And I think it's so important for parents to understand that these vaccinations help to prevent us not just from disease, but from disability and death. And they have been, again, integral in our public health initiative. Talking to people who have the evidence. As RFK has said, don't look at me. Ask the people who have the history, who have the training. Talk to your providers, talk to your physicians, ask for that advice, ask for that evidence, and you will get the appropriate information.
It seems to me that if the move was to establish public confidence in vaccine science, that it's done just the opposite of that.
It seems as though it has, and that's incredibly unfortunate. Again, trust is the most important component of all of this.